Hello, my name is George Murphy. I'm a family nurse practitioner student, and today I'm going to be doing assessment of your skin. We'll be going through looking at different parts of your skin. If at any time you feel uncomfortable, don't understand what's going on, you just stop me and ask me, and I'll explain to you. If at any time anything hurts, let me know. I'll certainly stop and don't want you to have any pain at all. Also, want to ask you right now, are you comfortable? Are you cold? Is the temperature okay right now? Okay. Very first thing I'm going to be doing, as I said, I'll explain everything, and I'm going to just look at your skin overall. I'm going to look at the general color overall. The color is very uniform. There is symmetry to the skin. I don't see anything unusual. The texture of the skin seems very similar all over. I don't see one particular kind of texture on one side, another on the other. Very much looks very symmetrical. Also, I want to check the temperature of your skin, if you don't mind. What I do is I compare the two sides. I want to compare your arm with the other arm, upper arm with this arm here. And the temperature of your skin is very uniform. I don't feel any area that's particularly cold or particularly hot, and that's very good. Another thing, the next thing I'm going to be checking is your skin tuger, it's called. This is how hydrated you are. Basically what I do is I pinch a little bit of your skin very easy, then I let it go and it falls. See how it pinch it and it falls? That means you have very good skin tension. You're not dehydrated. For people that are dehydrated, when we would pinch it, it would stay up in almost like a tent. Very good. Very good. And I don't see any skin dehydration, no tinting on your skin I see there. Also inspecting your skin for any lesions, any kind of rash or moles or any suspicious looking marks on your skin. And if you don't mind, if I can inspect your arm here too. Very good. The area in here is also very important. Very good, looks good. Also inspecting the area around your stomach, your abdomen. You do have a mold right here, but it looks okay. It doesn't look suspicious at all. And your chest looks very normal. I don't see any lesions or rash there on your chest at all. Also, would like to ask you to stand up right here and face the wall, because it's also very important that I inspect the back of your skin, also your back skin also. The same thing. Same thing as I did before, checking for temperature. Very uniform texture, color. The same as when I inspected for the first part. It looks very normal. Okay, if I could ask you to please lie down again on the table there.
Thank you.
You want to scoot up a little bit perhaps? Okay. What I'm looking for also is basic hygiene. It looks you take very good care of your skin. I don't smell any odors. There's no, your skin's not dirty, so I would rate your basic hygiene as very good. The next thing we're going to be doing is inspecting your nails. If I could see, please. I don't see, of course it would be better if we didn't have any nail polish on here, but we'll assume that you don't. I'm looking for the color of the nails are uniform. Do have one nail here that's without. The nail color looks very good. I don't see the nails are not separating from the base, from the nail base. Is very good. Also palpating the nails. No tenderness there, is there for you? Does it hurt when I do this? very good. You can relax your nails. They adhere to the nail beds very good. There's firmness there. The texture is very, very good. The color and the length, and they're symmetric. I don't see any ridging or any unusual formations in your skin there. The next thing we're going to do is to measure what we call your nail bed angle. And to do this, if you could hold up for me, and I'm just going to use a straight edge over here. We don't want that angle to be more than 160 degrees. Yours is right at 180 degrees. That's just perfect. Same thing there. Excellent right there. Little more than 180. Let's check this one. Very good. So all of your nails are within 180 degrees. They're not at 160 degrees or more, which would indicate clubbing, we call it, which can be a sign of some respiratory problems. So your angle of your nail bed is very, very good. Next, what I'd like for you to do, if you could please sit for me on the side of the examining table, maybe scoot a little bit more this way, if you would. I'll wait to the end, please. I'm going to be inspecting your hair. First, I look at it. I look to make sure that the color is very good. The hair is symmetric in texture. The quality of the hair, the distribution is very uniform, of very, very good quality. Next, I'm going to palpate your hair and feel the texture of it. It feels very healthy, doesn't feel brittle. So the texture of the hair is very, very good. Also, I don't see any infestations, no mice or no lice in there. So it's a very, very healthy hair. I see that you take care of it, so I would rate your hygiene on your hair as very good. Let me inspect the back part right here. Okay, very much. This concludes our inspection of the skin and your hair and your nail beds, and I want to thank you very much for your time today.
You're welcome.